Hi, my name's Tanya, and we'll be going over evidence-based guidelines for exercise prescriptions for patients with cystic fibrosis. So what is cystic fibrosis? It's also known as CF, and it is the most common autosomal recessive genetic and potentially life-threatening disease. It's caused by mutations that happen in the cystic fibrosis transmembrane conductance regulator protein that act at the cell's surfaces of all mucus-producing organs in the body. This particular mutation of a person's genes causes a multi-system disorder that affects the lungs, pancreas, liver, and intestines. Comorbidities that come along with CF include cystic fibrosis-related diabetes, also known as CFRD, hemoptysis, which is the throwing up of blood, osteoporosis, pneumothorax, which is the collapsing of the lungs, and urinary incontinence. The primary symptom seen with CF is progressive obstructive pulmonary disease, and this can actually lead to respiratory failure, which is the primary cause of death. On the last slide, I mentioned that this is a multi-system disorder and talked a little bit about the primary symptom, but here's a few of the other symptoms that come along with CF. As you can see, in the sinuses, you have sinusitis. In the lungs, there's a thick, sticky mucus buildup that also is found in the airways. And on the right, you can see how a normal airway would look, and then an airway with that thick, sticky mucus. The sweat glands produce an extra salty sweat. The liver has blocked biliary ducts. The ducts of the pancreas are also blocked. And in the intestines, there isn't an ability to absorb nutrients properly. Oftentimes, those with CF will have a G-tube placed to supply them with proper nutrients. And then their reproductive organs usually do not function properly, so those with CF usually have fertility problems. Because of the way that this disease impacts the lungs, there's a diminished pulmonary function that occurs that hampers physical development and can lead to lower fitness and muscle function levels. As you can imagine, this will have a negative effect on aerobic fitness levels and can actually lead to a reduction in life expectancy. In the past, those with CF would not make it to adulthood, but now with improved management, that's no longer the case in developed countries. The use of exercise in the management of CF has shown to have positive outcomes. When using exercise to help manage CF, it's important to take some considerations. First, an assessment should be done, and usually the assessments that have been done in the past have been a 6-minute walk test, modified shuttle walk test, and the 3-minute step test. All of those tests have proven to be helpful in the assessment of exercise capacity, fitness levels, and aerobic capacity, as well as endurance levels of patients with CF. Once the patient has been assessed, then an exercise prescription can be put together for them that includes both aerobic and strength training exercises. And it's important that this prescription be individualized because each patient may present the disease a little bit differently. When putting together an exercise prescription for someone with CF, it's helpful to look at what previous research has shown, and that is that moderate intensity exercise has actually been very beneficial. One study showed that aerobic exercise capacity can be improved with moderate intensity of 50% of VO2 max or 60 to 85% of heart rate max. And then once again, moderate exercise was shown to be helpful with those with CFRD if it's performed for 150 minutes per week. When it comes to the type of exercise that patients with CF should be doing, resistance and aerobic exercises have been shown to be most beneficial when they're performed 30 minutes at least 3 days a week. Although adverse effects of physical exercise training are extremely rare and exercise is considered to be safe for patients with CF, precautions should still be taken and all patients should be supervised and monitored. Exercise-induced oxygen desaturation is not only a mouthful, but it is exactly what it sounds like it is. It means that when a person exercises, that their oxygen saturation goes lower. So those with CF can actually have it happen even if they have well-preserved pulmonary function. So it's important to have supplemental oxygen close by and to monitor their SpO2 levels while exercising. So if it falls below 90% during exercise, that would be a time where supplemental oxygen should be used. When it comes to CFRD, that's the diabetes that comes along with CF, it's important to take the same kind of precautions that you would with another patient that has any other type of diabetes. So blood glucose levels should be monitored, and it might be a good idea to have a snack close by in case they need to take it, and their insulin close by in case they need to alter their dose. Although it has been said that sharing is caring, it is not so when it comes to respiratory pathogens. Respiratory pathogens have a significant impact on the morbidity and mortality of CF, so proper infection control practices are so important for them. And as we are now going through the whole COVID-19 pandemic, we now know more than ever how important it is to wash our hands. So hand washing before and after leaving the gym is important for them, and wiping down exercise equipment before they go into the gym and also after they do is especially important if another CF patient were to come in after them, because these respiratory pathogens can actually be shared between CF patients, and sometimes they have certain bacteria that are found in their lungs and air passageways, such as B. cepacia, which can be shared and actually can be pretty life-threatening if someone contracts that. Aside from hand washing and wiping down equipment, it's also important for patients to maintain a 2-meter or 6 feet distance if they both have CF to avoid contracting each other's pathogens and organisms. Incorporating exercise as a part of the management of CF has shown to be beneficial in multiple areas. There have been shown to be positive psychological improvements in the area of self-confidence, well-being, quality of life, and health-related quality of life, and a decrease in feelings of anxiety and depression. Exercise has also shown to increase pulmonary function by alleviating dyspnea, so having trouble with breathing. So the way that it does that is improving posture and increasing pulmonary function by helping with hyperventilation when you're running, for example, breathing more, and the mechanical vibration that happens with that, coughing that can also occur with that to kind of bring up all of that mucus and lung secretions that those with CF might have to clear the passageways. Osteoporosis, which is actually a comorbidity that can come along with CF, can be protected against with the use of exercise. CFRD can also be managed through the use of an exercise program, since exercise can help to improve glycemic control by improving insulin sensitivity, and that also aids in reducing systemic inflammation. The following is what an appropriate exercise prescription based on the previously mentioned research might look like. There's not necessarily an ideal exercise prescription for those with CF, but it has been recommended that the same principles used for healthy individuals and other chronic respiratory diseases should be applied. So when it comes to repetitions, sets, and holds, that's all based off of recommendations for the general population. To start off with, I'd have them do a warm-up where they would walk at a low intensity for about 10 minutes. And the aim here would be to get their heart rate within 10 beats of their target heart rate. For the aerobic exercise portion, the patient can jog at a moderate intensity so that their heart rate is 60 to 85% of their maximum heart rate for about 20 to 30 minutes. For the resistance portion, they could do 3 sets of 10 of chest presses with free weights, lat pull downs, and leg presses, all at 50% of their 1 rep max, and then squats against their own body weight. 3 sets of 10 at 50% of their 1 rep max were chosen to improve muscle strength. The upper extremity strength training exercises are focused on improving posture to aid in opening up the chest for better ventilation. Because CF can cause low fitness levels and muscle function levels, the focus of the lower extremity exercises are to increase the strength in the major muscle groups in order to make activities of daily living easier. For the cool down, the following stretches are recommended: cat-cow, contralateral limb raises in supine, and child's pose. These all should be held for 20 to 30 seconds for 2 to 5 sets. These stretches also focus on large muscle groups and opening up the chest. When doing this exercise plan, resistance exercises can be done 2 to 3 days a week, and aerobic exercises can be done 3 to 5 times a week. Modifications may need to be done depending on the patient's tolerance and comorbidities. Here's a list of my references, and thanks for listening.